A call for doctors to have regular mental health screenings for pregnant women and new mothers. It's part of 10 new guidelines to improve their well-being and stem the rise of maternal depression. Pre-COVID figures show that the condition affects 1 in 8 expectant mums and 1 in 14 new mothers. And doctors warn that the pandemic has made it worse. Charlene Xia with more.
The process of motherhood may be obvious to the eye, but what most can't see is the state of their mind.
One of the things that they often share with us is this self-blame about not being a good enough mother because they feel they can't attend to baby. And a lot of this comes along because of the sense of low mood that they have and the loss of interest and joy in, doing what they would normally like to do. And towards their baby, they don't feel anything. And very often this is something that they feel ashamed about and actually very guilty, and that drives their depression.
KK Women's and Children's Hospital saw a near 50% increase in patients with postnatal depression during the pandemic compared to before.
There was a lot of anxiety, and even the women who wanted to have families, they weren't sure whether it was safe to start a family. Of course, the social isolation was really hard. Some mothers were cut off from their families. On top of it, there was the economy that was affecting jobs and lives.
The hospital says it's critical to address the rise in mental illness, especially through early intervention. The set of 10 guidelines cover the whole journey from before pregnancy to even 1 year after childbirth. That includes advice on what to expect with the new journey of motherhood and suitable lifestyle adjustments, as well as what to look out for to screen for possible cases of anxiety and depression and the type of care, support and treatment that's needed. A KKH survey on 600 women found that while almost all of them know how common these conditions are, only 2/3 are aware of the telltale signs. Also, more than 3 in 5 did not receive any mental health advice from their doctors. All the more pressing as studies show the real risk to a child if a mother is depressed or anxious.
This heightens the child's vulnerability to mood or anxiety disorders later in life and has downstream implications on the child's learning and their behavior, such as their language development, their cognitive development, and executive functioning.
Besides specialists, the guidelines will also be shared with family doctors, nurses, and social workers.